won another award this morning, and it was quite simply the best new podcast that comes out tomorrow. Whenever you watch this, we like to have a lot of fun, but in all seriousness, I'm here to save your life. I'm more appropriately to say I'm here to help you save your own life. And I'm going to talk in this short video about migraine headaches, why taking medication is devastating, why the headaches themselves are dangerous to your body, not just with the pain that they cause, but your overall health. So stay tuned. I'm going to walk you through exactly what causes them, how to get out of it, like what we do to help people. And if you don't live in the North Texas area and you need help somewhere, just message us. You can find us on social media, HootenFamilyHealingCenter.com, or through our website at drhooten.com. And we'll try and help you find somebody close to you that's qualified to help you get your body right. So this is very typical around here. This is my buddy, Morris. Hopefully he sees this podcast. We took this picture just Friday. Morris has been coming to see me now for, almost 10 years. But he showed up with migraine headaches that were debilitating. Like they would knock him out. If you have headaches, if you know somebody that has these migraine headaches, maybe you get the aura, maybe there's some vomiting involved. Not a good situation. And ultimately, you're probably going to reach for some kind of help, right? You go to the medicine cabinet and try some over-the-counter things. There's a big problem with that. You go to the doctor, and there's a even bigger problem with that. And you're always going to wind up trying to treat this symptom with some type of pill. And I've even had some people come in here who had a surgery to block the nerves going in and out of their head to try and alleviate these headaches. Because nobody wants to be in that kind of pain. I totally understand that. The issue with going to the medicine route is that all they're going to do with the medication is cover up the problem. So you need to understand what ultimately is causing these headaches. And there's a very few number of causes. You're told things like stress-induced dehydration and that kind of thing. But ultimately, it comes down to the basic needs of your brain. If your brain is running low on oxygen, if your brain is running low on nutrients of any kind, it will start to swell up just like anything else in your body that gets damaged. Like, just to give you another example, if I sprain my ankle right now, it swells up. If your brain tissue and the arteries and everything going in and out of your head are under duress because of stress or dehydration or whatever, these nutrients aren't getting in and out of your brain, and your body goes into this freak out mode, and it's going to swell up and attempt to try and fix itself. Well, that swelling, that inflammation, even if it's an artery that's blocked in your head, all that swelling and everything, that hurts. So, this pressure comes around your eyes and your head, and sometimes you throw up because of the vagus nerve. Well, if all you do is take a drug, what you do, and this is whether it's over the counter or a prescription, you're giving your body a false sense that it's okay. It's still not okay. The analogy is like if you have a plant in your garden that's sick and it's getting withering because it's not getting enough water, and all you do is throw fertilizer on the plant and you're not giving it water, you're missing the mark. So if you just pour a chemical or put a chemical in your body to fix it, you're going to get worse. The plant will get worse, your body will get worse, your brain will continue to deteriorate because it's not getting the proper nutrients. And you turn around a year later, 5 years later, and things are worse. And maybe you're taking more medication. And ultimately, what I've seen in practice in 24 years now is that people that do that, inevitably they have a stroke because all this pressure builds up, the arteries start expanding, and eventually something pops. And that's, it's way too late at that point. Things have really gone sour then. And I don't want that for you. I mean, if you have headaches and you want to avoid a stroke later, raise your hand. Well, taking medication and just going that route and going to the doctors and neurologists, that is going to lead to more problems. Not my opinion at all. Just look up the side effects of the drugs. Some of the earlier ones like Imitrex, Topamax, and Zomag, they carried with it side effects of heart damage and heart failure. So anything that hurts your heart, trying to fix a headache, doesn't it stand to reason that you need to find a better path out of that? So that's the symptom mindset. Now, being a chiropractor, if some people think going to the chiropractor is going to fix my headache. And there's all kinds of research about this, and people do get relief from coming to see us. However, it's in the understanding of how that works that gives you the real long-term solution. So we look at your body. Let's say you come in like Morris did with these headaches, and I say, okay, Morris, you have to understand that this is a symptom of an underlying problem, most likely coming from your spine. And the reason that happens is your brain and your spine are totally 100% connected. There's a flow constantly up and down your brain, spinal cord, all the way down to your tailbone, back up to your brain. The nerve tissue in there is carrying signals from your brain to your body. This whole thing is like a giant river of awesome power that God put there to run the show. It's in charge of getting oxygen to your brain. It's in charge of your heart, your cardiovascular system, everything. So this thing needs to be flowing. If it's blocked, let's say you kink your spine a little bit, and our term for that is subluxation. Well, that's just like kinking your hose going to your garden, and your garden's going to get sick and suffer. Well, if your spine is blocked, it's keeping nutrients from getting out of your brain. It will build up pressure up here. The pressure can't get out, and you have to get this flowing. So that's what I told Morris. And he said, well, this is the first thing that's made sense. All these doctors want to do is drug me. I feel like I'm getting worse. Other things are happening in my body, like he had some other pains now. And I said, let's start with taking these x-rays. And we took them, and I showed him that day. I said, look, from the side, your neck should have a curve in it. And his neck did not have a curve in it. It's very straight. And it had been straight that for a long time that the bones and joints had started to deteriorate. So there was some arthritis in there. Maybe you've had x-rays or MRIs of your neck, and there's herniated disc and stenosis and all these different things. That is a sign that your spine has been deteriorating on the inside for a long time. So that's what I told him. I said, look, this isn't just a today problem. You've been building this up probably for decades. What you have to do is get your spine in shape. And just like anything else, that takes time and repetition. I mean, how many of you want a quick fix? Who doesn't, right? If you want to lose weight, shouldn't you be exercising and eating right regularly, not just once a week or when you hurt or when you realize the scale says 350 pounds? No, you should be doing things regularly. And that's what I told him. You're going to have to take care of your spine now regularly. But the benefit is you get this flow, and guess what's going to happen to those headaches? And he said, they'll go away. I said, yes, I just don't know when. And over the next few weeks, his headaches were getting less. And then within a couple of months, his headaches were gone. And that's a way in the past now. He traded in all that agony that he was in for years, and his headaches are just gone. Is his body perfect? No, he's working. He's living. So he comes in here regularly to keep his body healthy, but the future looks bright. And instead of taking medication and getting hooked on these things, he now lives what we call a max living lifestyle, or a Hooten chiropractic lifestyle, where he keeps his body in as good a shape as he possibly can. And he's looking forward to being 70 and 80 years old and not falling apart and not having strokes because of these headaches that he was having. So what does the treatment look like? Well, on that first day, when he has that pressure built up on his spine, using my hands very gently, I move the bones. All right, and I have some instruments here. I've got what looks like a massage gun, but it's affectionately called the mini jackhammer. It's called an arthrostem. That will help us get some pressure off. And if you've watched our Instagram channel, you see me pulling on people. There's specific terminology for that. The MTA is like the boring name. We call it the life changer. And it's been called a whole lot of things, lovingly the Jackie Chan. But if you see me pulling on people, Morris's spine had deteriorated. It had compressed. So I did a gentle pull on him, and he heard all the popping in there. It didn't hurt. It kind of fit. Fellas, you're here recording. Y'all been adjusted. Would you say it feels good to get adjusted?
In the beginning, it did.
Probably not, but does it hurt? Would you
No.
say no, it doesn't really hurt, but it doesn't tickle. It's just like, it's more like a quick pressure.
Yeah.
And if there is some discomfort, it goes away really quick. But the benefit is that this pressure was now off of his spine or his water hose, and woof, his body began to heal. So did Morris come in here with headaches, migraines? Yes. Did I heal him? No. I moved the bones. God shows up. Well, actually, God is always there. His bones were physically blocking the power that God put in his body. So his body fixed himself. There's no trick to it. There's no magic. I'm not pouring any voodoo or chocolate or lighting candles and saying seances or anything like that. I do pray over everybody, The prayer I say is, God, please open this person's mind and heart to the truth. Please guide me in what I say. Let me be your vessel. Let me convey the message you want me to say to them and explain to them how to get well. And then guide my hands so that I adjust them appropriately. It's really that simple. And after I started doing that in 2000, in the year 2000, and I saw these results, I didn't make it any more complicated. There's all kinds of therapies that people do. There's all kinds of stuff people try. But the main thing is the main thing. If you get this spine flowing, your body will be, it won't have a choice but to get well. So if you've got migraine headaches, please reach out to us. Come find us. We're in Addison, easy to find. We're very close to Beltline on the Tollway. Just look us up, drhooten.com. Remember, drugs are bad. God is great, and so are you. We'll see you in the office.